Joining me today, Ashley Ageloff on Alternative Viewpoint, and Ashley is from your limitlesshealth.com. Did I say that right?
You did.
Okay, great. Well, Ashley, you do thermography, and I almost automatically want to say breast thermography because I think that so many people associate thermography with examining the breast or screening the breasts. Can you tell me a little bit about that?
Yes, so most people do associate it with just the breasts, and it is an amazing screening tool for breast cancer and other issues. However, it can actually do full body thermography. Have you heard of that before?
I have. Can you tell our viewers some of the things that we might see on thermography when we're looking at the whole body?
Sure. So one of the most important screenings is the cerebrovascular screening. And they actually take an average temperature on your forehead. And if it's over 0.3 degrees Celsius, and that's actually something that they want to monitor. You may ask why. And that's because we actually have our supraorbital arteries on our forehead that are linked to our internal carotid arteries. So if one part of our forehead is colder than the other, that can indicate an issue with our carotid arteries and may indicate blockage. It's not necessarily the case. It can also be possible scar tissue or eczema, but it is something that you would want to look into because it can possibly be early detection of a stroke. And how amazing would it be if you found that early enough where you wouldn't have to have a stroke?
Right, sure. Now, I guess you probably see, since you see the temperature changes up there, you probably see the arteries here, and you probably see a lot more than just the forehead, and you're looking at the whole body, right?
Yeah, that's just one of the screenings because you can see the internal carotid arteries. But other things that you can even see oral inflammation, and many people don't realize that there's so much bacteria in our mouth, and that can actually leak into our lymphatic. And you'd actually be able to see the lymphatic system if there was an issue there, the blockage from your oral cavity into your lymphatic system.
Okay, I see. Now, some more questions about thermography in general. See, I guess if we're going to compare it to other screening tools, and we call it a screening tool, right? Thermography is a screening tool. What other screening tools might it be compared to?
Yeah, another screening tool is a mammogram. That's a screening. They're looking for calcifications in the breast when thermography is a physiological test rather than an anatomical test. So it's looking for the abnormal heat patterns. Versus in a mammogram, they're looking for lumps or bumps. But the only way it can actually be diagnostic is if they actually went in there with a biopsy and saw exactly what it was.
All right, so that's kind of the same with mammography, right? You're saying both of those would be to diagnose, you would actually do some kind of biopsy or further testing?
Right, that's how you would know exactly what it was, but the mammogram as well as an ultrasound and thermography are all screening tools. Okay,
I see. Now, when it comes to mammography, we're actually using radiation, which I think is interesting because a lot of times we're trying to rule out cancers or screen for cancers. But radiation, we know, is actually a cause of cancer. When you are getting a thermography, does anything come out of the machine going into the patient?
No, there's no radiation. It's non-invasive. It's like you were just standing there for a picture. I actually do all of my patients' children if they're under the age of 16 for no charge. They just have to pay the interpreting doctor fee because, unfortunately, the interpreting doctors have seen cancer in children, and even they can get it. So if you catch it at an early age, you can avoid so many issues down the line.
Earlier we were talking, and you said something about you could not even get a mammography unless you were 40 years old. Is that true, or is that the case?
It's true because they don't want women getting mammograms if you have dense breasts, and a lot of younger women have that. I've also seen lately a lot of people have been coming in, even older women, and they say, oh, they told me I can't get a mammogram, I have dense breasts. And unfortunately, thermography is not the mainstream of care, so unless people have really done their research, they won't know that us thermographers are even out there.
I see. So you can start this at any age. You don't have to wait till you're 40. The one question that probably everyone wants to know, will insurance pay for it?
Insurance will not pay for it at this time. Many people do believe that it is well worth it for early detection that can save your life. A full body scan is only $4.99, and we even offer payment plans where people can break it up into 4 payments so that it's affordable for everybody to get one and start at a younger age. As long as you can take a picture, you should be getting one.
I think that's great. You know, insurance won't pay for my supplements or my food or anything that I do healthy. They don't pay my gym membership. Insurance really doesn't seem to be in the healthcare or even the preventative business, and they are in the business to make money, so why would they want to pay for something that they don't have to yet? I would imagine someday they're going to have to, but for now they're getting away with rejecting paying for this excellent screening procedure. All right, when it comes to getting tested, if we were to compare it to mammography, you know, I've only heard, because, you know, I don't have breasts, so I've never got a mammogram, but I've heard it can be pretty uncomfortable and maybe even damaging to the breasts.
Yes, that's what I've heard too. I've done lots of research. I am actually not at the age yet where I can even get a mammogram done, and I've already started getting thermography. I get one, a full body, every 6 months. But with a mammogram, they actually press down the machine on your breasts, and if you actually have cancer present, that can actually spread into your entire body because of the radiation and the compression. So it's really important to get a thermography, and then from there you can decide if you want to go ahead and get an ultrasound or a mammogram. I normally tell people to get the ultrasound.
I see. I know that massage therapists and chiropractors are not supposed to work on areas that have cancer for that same reason, because if you're mechanically irritating a cancer, you could actually spread it to other parts of the body. So not the best imaging procedure. Thermography, you're standing in front of a camera, there's no mechanical interaction, possibly maybe, you know, turn side to side, let me, you know, get a back view or whatever. You're looking at the body without any physical intervention, correct?
That is correct. I just take pictures of the entire body. People come in, they acclimate in the room because their clothes do hold a heat impression, so you have to stand in a cold room for about 10 minutes at 72 degrees. I come in, I take the pictures, it's done. Most people leave, they go, oh my goodness, that's it? If you look at testimonials on the website, everyone always says, I didn't know it would be so easy and so painless. So yeah. No pain associated at all. I've done tons of kids, and even the kids, it's nothing for them.
And these pictures, they go on in a digital format? Do you print them out, or what do we do with them from there?
After the pictures are taken, I send them to 3 interpreting doctors. The main interpreting doctor is a gynecologist, and he also has his PhD in thermology. He's been doing it for over 40 years, so it's awesome. He looks over every report. And after they go ahead and interpret the reports, in about a week, you'll get the report back. And then I go over it on the phone through email, so somebody can open it up. If some people actually don't have computers, because my oldest patient's actually 94, so if they don't, I can mail them the report and go over it with them that way.
Oh, excellent. Okay, well, great. Well, that's Ashley Ageloff. Ashley, I want to thank you for joining me today. And we're going to put your details, your website, in the description below this video. So for anyone that wants to find out more information, go ahead and look in the description, follow the link, visit the website, and schedule your screening test now, your thermography exam now. Ashley, thank you so much for joining me.
Oh, thank you. I look forward to seeing you again.